Hello, my name is Yonit Lax, and I'm an attending physician at the Maimonides Children's Hospital and an assistant professor at SUNY Downstate Medical Center. Today I'm going to be speaking with you about the work I completed alongside my colleagues, Suzette Brown, Michael Silver, and Nicole Brown, on the associations between participation in after-school activities, attention deficit hyperactivity disorder severity, and school functioning. So the idea behind this study actually came from my clinical practice. I was seeing many children with poorly controlled ADHD, and I began to look more holistically into what were their environments at home, at school, and how were they filling their time in between. I began working together with these families to find after-school activities to enroll their children into. And after working with several families in this manner, I found that the ADHD severity improved, and they reportedly had improved school functioning. I wanted to explore further if there was any evidence to the association I was seeing. Global benefits of after-school activity participation for children and adolescents in general are pretty well established. Prior research shows that the positive impacts of after-school programs that specifically employ psychosocial treatments and target children with ADHD, and the potential for benefits of after-school activities that focus on physical activity, such as the one that we see here done by Michelle Obama in the Let's Move campaign, have on ADHD outcomes. However, no other studies to date had examined whether after-school activity participation more broadly is associated with ADHD symptom severity or school functioning, and that's what we set out to do. So we conducted a cross-sectional study, and we used data from the 2016 National Survey of Children's Health on ADHD severity, after-school activities, and we chose two domains of school functioning among children who had ADHD. The first was the number of missed school days, and the second was the number of calls home from school. Then we conducted a bivariate logistic regression to examine the associations between our primary independent variable of interest and our outcome variables. And we then did a multivariable logistic regression to measure the association between our independent variable and the outcome variables adjusted for sociodemographic characteristics. So what did we find? We found that children with ADHD who participated in any after-school activity at all had lower odds of parent-reported moderate to severe ADHD. So while we knew that after-school interventions focused on addressing ADHD symptomology had previously been demonstrated in the literature, findings from our study suggest that children and adolescents with ADHD may benefit from participation in after-school activities more broadly than that. We chose to study missed school days to capture school absences, as absenteeism is often associated with poor academic achievement, learning, and ADHD severity. And we found that after-school activity participation was actually associated with lower odds of 4 or more missed school days among children with ADHD. This added to the limited data that already existed on factors associated with school attendance among children and adolescents with ADHD. And this finding may have some important implications for efforts that are aimed at reducing chronic absenteeism that we see among this population. So we did not find a significant association between after-school activity participation and calls home from school. Calls home from school usually signify substantial difficulty children are having in the classroom setting. And because after-school activities are taking place outside of the classroom setting, it may actually be possible that after-school activities do not impact this particular measure. So our study highlights the potential for after-school activities to lower the risk of school absenteeism and symptom severity in children with ADHD. After-school activity enrollment may be considered as part of a multimodal approach to ADHD management. Pediatric, school, and behavioral health providers should consider formalizing partnerships with community-based organizations and after-school activity programs to promote the enrollment of children with ADHD. Further research Examining the type and duration of after-school activities that impact ADHD outcomes among children and adolescents is warranted. Thank you for listening to my talk. I hope that this spurred some conversation and thoughts on the role that after-school activities has in children and adolescents with ADHD.